Okay, sounds good.
Hi, everybody. It's Kathy from Kickstart Physical Therapy, and I'm here with Dr. Monica Esposito of Ascend Concierge Medicine in Tampa. And you are a family practice medical doctor,
Correct.
Physician, yes. And it's really happy to have you here with me.
Thank you so much. It's a pleasure.
Yeah, so I was kind of wondering how you got started in medicine and just a little bit about your journey, if you could explain that and how you started, how you kind of converged into the concierge model of medicine.
Absolutely.
Okay.
So I guess first question, I initially was more interested in engineering and architecture, and I always liked kind of the math and science and creativity. And my brother ended up getting sick at age 10. So this was when I was in middle school. And he actually nearly died. He ended up having to get airlifted to Miami Children's Hospital. It was a really bad situation for our family. And it was a scary time for us because there was a lot of uncertainty with his treatment. They were really struggling to figure out exactly what was impacting him. He ended up having multi-system failure.
Wow.
So during that whole, problematic journey, we had so much time that we felt like we had no control over what was going on with our lives and no control over what was going on with, my parents as our son and me, my brother. And I didn't like that feeling of helplessness, being, stuck with a loved one in critical care. So he thankfully made a miraculous recovery. The doctors and nurses there were exceptional. And, he recovered fully, and now he's healthy and kicking and being an adult.
Yay.
But at that point, I decided to pivot and, kind of pursued passions more in the science arena and medical side. And as I progressed through schooling and, went through all the high school science classes and everything, I realized that that's actually really where my passions lied, and that it was actually the right path for me anyway, just because it really seemed like it kind of clicked.
Yeah.
So I went in and, did all my schooling, and I was pretty steadfast on that all the way straight through. And here I am.
Wow. Yeah, I'm so glad you are. Yeah.
So I have my brother to thank for that in part. And, we kind of have a running joke about that since it's long since passed and since he recovered fully, of course.
That's wonderful.
But
so glad he's doing well.
Yes, thank you.
Yeah.
Yes, so are we. He's my only brother. So who am I going to pick on, if I don't have a little brother, right?
Of course. Well, he'll pick on you. A lot of times little brothers end up doing that. I have one myself.
Oh, yeah. Honestly, it's probably more like that.
Yeah.
I'm the protective bigger sister, right?
Yes, I can relate.
And then I know you asked about kind of how I transitioned my career towards, this style of practice.
Yes.
So I initially, when I graduated residency, I was working in more of the fee-for-service world. So I saw my patients, I was under that kind of corporate umbrella, and it worked well for a while. I was a new graduate and I was kind of getting my sea legs, getting used to the idea of being an attending kind of out on my own, doing my own thing. And it worked well, and I loved seeing my patients, and, it served its purpose. But ultimately, as time progressed, I saw more and more of the ugliness that comes with, dealing with some of the insurance barriers for patient care and the issues that come with not being your own boss and having, the corporate confines and restrictions and things where somebody's telling you to adjust how you're doing something or adding things to your daily schedule or adding people that, you have to be in charge of in terms of, physician extenders and things along those lines. And ultimately, I didn't think that was the direction that I wanted to take. And I wanted to make sure that I was able to, number one, first and foremost, emphasize patient care. Because to me, that's the whole reason I went into medicine, is taking care of patients.
Right.
But not only that, I wanted to make sure that I was really keeping a work-life balance, because the only way that my patients are going to get my best is if I'm at my best. And if I can't balance out my own life and keep everything even keel and have time for, my children and my husband and my life outside of work, then they're not going to be getting me at my optimal level either. Right. So it does both of us a disservice.
You're setting an example.
Exactly. Yeah. So I ultimately decided to part ways with that chapter and started up Ascend Concierge Medicine. And in this arena, I chose to completely go out on my own rather than using any sort of corporation to help me start my pathway. And thankfully, I had a lot of really good people to, help pick brains and, get some of the ideas, because I'm going to tell you right now, medical school does not prepare you to be an entrepreneur. They do not teach us anything about that stuff.
No.
So everything was a learning curve. But it was a fun one. I've really enjoyed the process. And at this point, we're just about a year since opening our doors, which is incredible. I can't even believe that it's been that long already. Yeah, time flies.
Yes.
But when I opened this place, I wanted it to be a completely different patient experience. I wanted it to be something where patients could come in here and feel, calm and at peace and feel like their voices are being heard when they come into the office. Whether, they have something small, whether they feel like they've been gaslit by the system because people are just like, oh, it's just your hormones, or it's just you're just being anxious, or you just this, just that. And I can't tell you how often patients' issues have been minimized and they feel like they don't really have a voice in their own care.
Yep.
And, that's doing them a disservice. And ultimately, it means that we can't do our job as completely either. So I opened this place with the thought in mind that it would be more patient-centered care, much more personalized approach, no rush. So we have plenty of time. My intake appointments for new patients are 90 minutes. I do complimentary consults. So when people are coming in, they can talk to me and meet me and see the space before they commit to anything.
Right.
My normal follow-up appointments are 60 minutes. So nothing is ever rushed. People come in here, they get greeted in the reception, they get brought back right away without having to wait forever for me. And they get everything done in one space, easy breezy, without feeling like I'm constantly, checking my watch versus actually paying attention to them while they're having their time.
Right. Looking at the whole person.
Exactly.
Yes.
But it's been really nice because I think, my patients appreciate having that time and that real connection with their physician where they know it's me that's going to be taking care of them, or, it's my front office, Barbara. She's an amazing paramedic. Yes. She does all the lab draws and IVs and gets them all set up. And they know our faces. They know who we are as people. And it's more, you're not just a number here. You're treated as a human, as a person, and treated with dignity and respect at every corner.
Yeah. I think you're both very personable too, very approachable. So I think that makes a big difference. Because people want to be able to relate in the medical field, How often do we go into a physician's office and the bedside manner is just atrocious? So I can attest that you are just very warm and personable person.
Thank you.
So is Barbara.
So are you.
Thank you. Yeah. I guess that's why we work well together. Yeah.
Yeah, right.
So
I think that's probably part of the reason that both of us went out and kind of hung up our own shingle as well, because when you're doing this style of practice for both of us, we're spending a lot more of that one-on-one time with our patients. And if you can't have a conversation with patients and you don't feel comfortable being around other people, you're not going to do well in that arena, right?
Yes.
The people that don't have the personality and the ability for those social interactions would struggle much more so in this case. And it's a testament, I think, to our abilities to really focus on that patient connection in both areas.
And I think it's also a skill set. So, then you have the other side of the coin where you have the personality, but you have somebody who has very basic skill set. And so I think that kind of moving up that level and really, increasing your game and lifelong learning type of thing, I think that really makes a difference too. So you're not just getting the personality, because a lot of times you'll go to a clinic and you'll get the personality, but you're not getting the high level of care. And I think that the combination of those two things together is really the major win right here. Yeah.
Yes, thank you. And I mean, one of the kind of cornerstones of this practice is that I want patients to, when they sign up, feel like they don't have to worry about any random nickel and diming. We don't have a la carte services here. Everything's included. And, because I am board certified in family medicine, I can treat women's health issues. So, I deal with some of the hormone replacement, with pap and pelvic exams. I do testosterone therapy for my gentleman patients. The GLP-1s, I use in practice when I feel like they're appropriate. I don't automatically prescribe them. I'm not a weight loss clinic, but in places where I think that they're appropriate and indicated and the patients are prepared to, actually utilize them in a good way, I do those. We don't upcharge for being able to prescribe those. I do joint and trigger point injections here. We do IV infusions for people if they get sick, because I would always rather keep my patients here versus having to send them to the ER. If I can avoid an ER trip for them or an urgent care trip for them, and they can come in here and get their things handled, I would always rather simplify the process, make it easier, smoother, and also avoid the extra charges that would be associated with all of these other different arenas.
Right.
So, we try to make it as one-stop shop as possible, very comprehensive, family medicine clinic where people can really feel like I do everything in my skill set, everything in that spectrum for them without exception. Mm-hmm. And ultimately they know that if they need something outside, I'm going to send them and I'm going to coordinate that care as well. So if they need to see a cardiologist because there's something more substantial going on that is outside of my wheelhouse, I'm going to coordinate that and make sure that we're on the same page. If they're seeing oncology, nephrology, any of the other specialists, or even physical therapy, when we have to send out, having those clean lines of communication, even when I'm not the one directly providing care, it makes a huge difference for ultimately what the patient is getting. And really making sure that the patient is on board with everything and understands the process. Right.
It's sort of like integrative medicine. You're actually working with the other specialties to really best treat the patient. So this sounds like, the ultimate patient-centered care, which is really what we're all about. Yes, this is why we're doing what we're doing. Yes, that's definitely because the patient idea. Comes first, right? Yeah. Mm-hmm. Yeah.
Now, I think it's really interesting to see just how well we can treat patients and not just make them feel a little better, but optimize their health and their wellness and, their agility and their longevity through a multimodal approach. There's a lot of things that I can do in the office. And, so I try to teach them a little bit, some about like the exercises or things that they can do that were okay with their bodies and some of the nutrition. But I have colleagues in, physical therapy like you, people in the dietitian side, people in the pelvic floor therapy, which is super underutilized for my female and ultimately male patients even. And, when everybody works together and does all this stuff, even, the preventative cardiology side, we can do so much better for our patients and ultimately really focus on achieving a higher echelon of care and getting our patients to a better level than they really even knew possible versus just practicing a reactive medicine. And it's really the way of the future, I think, in medicine.
Yeah. And then maintaining it, I think, is really important as well to try to, because I do a lot of wellness and, and I'm sure you do well checks as well, just to make sure that people are maintaining that, that goodness and that level of health that they should. Yeah.
Absolutely.
It's very important. Otherwise, they're going to fall back into the old ways.
Well, and part of it, I think, is patient empowerment. Mm-hmm. Sometimes they don't know what they don't know. And by having that time to converse with them, to do some teaching, not just talking at them, to have time to break things down, kind of figure out what their level of understanding is on some of these topics, and making sure that we're on the same page when it comes to, some of these lifestyle modifications and things. You can't achieve that type of educational process when you have 10 or 15 minutes with the patient. Mm-hmm. But when you have an hour, you can sit and talk about this stuff. You can make sure that you're on the same page. And it's an absolute game changer because there's so much that we can do for our own bodies when we have the proper guidance in terms of diet, exercise, stress management, getting into a stretching routine, even getting appropriate sleep, appropriate hydration. These all sound like simple concepts, but they're not. Right. And if you ask the average person about what they're getting and if they think they're getting enough of all these different areas, I would guarantee you that probably 9 out of 10 of them would say no.
Right. Yeah.
It's
I believe it. Yeah.
Easier said than done, right?
Yeah, true. And I think also asking patients what their goals are is really important, and involving them in that goal planning process, because goals, like you say, we're not talking at people. So goal planning really is patient-centered. So not every patient wants to do the same thing as everybody else. And what we think they might need might be a little bit different or modified in some way. We could modify things to make it more, I guess, achievable. Mm-hmm. Yeah.
Yeah, I mean, and I think what you're talking about somewhat is that patient autonomy, their ability to create their own future and their own goals, and us being there kind of as guides rather than as people that are telling them what to do.
Right.
And I mean, over the years, I will tell you right now, patients always respond better to that approach versus somebody with the God complex telling him, this is what you need to do.
Right.
You know, it's like, well,
Yes.
you know, ultimately it's their body. And if they choose to, you know, go with the direction that we're giving them, that's great. Sometimes they won't. And that's okay too, because it's ultimately their body and their decision on how they proceed with, you know, the education and the guidance that we give them. And I mean, it's really not one size fits all, because you're not going to treat, you know, your professional athlete patient the same as you're going to treat, you know, your premenopausal woman that's having some adjustment issues with her hormones.
Right.
Not the same as your 78-year-old that's dealing with some early dementia and a little bit of frailty and needing to adjust their lifestyle to try to like build up some muscle to keep active and be able to do their ADLs every day.
Sure.
So there's so much variability in what on both sides of the spectrum, what we can do, how we can help these patients. And you can't practice cookie cutter medicine. It's not possible. It doesn't make sense. And I think that really the direction that we're taking and the ability that we have to really delve deep into each patient and their unique needs makes such a huge impact on the quality of care that they're receiving.
Yes, I agree. And I think a lot of times when we see patients are very well informed nowadays, so they're constantly doing internet searches, YouTube videos, social media. So they're getting a lot of information, which is good. But at the same time, that it should be individualized to that patient, because not everybody fits into that cookie cutter mold, and for what's right for one person is not necessarily right for another. So I think that's where we come in, where we can say, okay, tell me about you. Let's look at you and your individual needs, and then we can tailor something to you. Yeah.
Well, and I think you bring up a good point about, you know, so much of the media out there, it's both a blessing and a curse. You know, we have patients come in and they have education on some of these topics, but the problem is that without having the background, sometimes it's hard for people to know what's real and what's not, what's credible and what's not.
Right.
You know, so somebody out there that has 1 million views on Instagram or on TikTok may be very credible sounding, but they may have no leg to stand on when it comes to actual scientific training or background in the field. And they may just be really good at talking.
Right.
So ultimately, it sometimes can muddy the waters, and having that connection where, you know, your patient really trusts you as an expert can help kind of guide them through and make sure that not only are they getting that time to educate themselves, but they're getting credible sources. They're getting good information that's not going to lead them down a harmful path. And I'll give you an example. So I have seen both outside of this practice and even within my practice, people end up with liver damage from taking supplements. People associate supplements as a safe space. It's automatically, oh, it's a natural thing. I'm doing this for my body. It's not bad like drugs, right? Well, unfortunately, not all these things are created equal. And some of the supplements can actually be significantly harmful to the degree that I've seen people end up with liver transplants as a result of the damage that these things can cause. So people knowing what they're putting in their bodies, what they're doing to their bodies, and having good, reliable resources to use to help guide them on those paths towards wellness, whether they want to be more natural, whether they're comfortable with medications, whether they want to avoid any type of pills and they just want to work on the diet and exercise piece. There are fads in every arena, and some of them are good and some of them are not. And being able to delineate what is going to be safe and healthy, not just in general for the population, but specifically for their body, for their genetic input, you know, for their size, for their age, for their cardiac health. It makes a big difference. It is not, again, going back to that concept, it's not one size fits all.
Sure.
Everybody's different.
That makes sense. That makes sense. So can you give a couple of tips to some of your patients, just overall in general, as far as wellness and health, that type of thing? What is something you would normally tell somebody in general?
Gosh, there's so many little gems here.
That was a loaded question.
Oh, that's okay. I'm used to hard questions. I mean, I think one of the most common things that I see that's detrimental for our health is people chronically underhydrating. And as we start heating up, it's going to even be more prevalent in Florida because people lose so much water just existing, even going back and forth to their car because it's so hot outside. So, people chronically underhydrating, it definitely contributes to fatigue. It makes you more prone to having issues where you feel lightheaded when you change position, especially as you age. And ultimately, it can impact your cardiovascular health as well as your mental health. So one of those things is I work with them to make sure that they're optimizing their hydration every day. It isn't always easy because some people are like, I don't really like drinking water, but we work with it and kind of adjust. And that's probably one of the first things, because every body system depends on water. Your body is primarily made up of water, right?
Yes.
So it's there for a reason. And whether you like it or not, it's going to be a big part of your overall health picture. Even in the beauty side, when, you want to have that nice, plump, hydrated looking skin. Another biggie is actually doing strength training. So a lot of people will work on, they want to look good in their bikini or things like that, and they want to feel good. So they'll go and they'll do their cardio. And cardio is great. It has so many amazing benefits, but your workout is not complete without doing at least some weight training.
Absolutely.
Weight training is so beneficial on so many levels. It's really helpful as we age to help maintain your ability to do those activities of daily living and being able to, push and get up out of your chair on your own and do these different things that we kind of take for granted. And then it also comes into play when you're trying to ward off, things like osteoporosis. And it's great in terms of, maintaining agility. And obviously for people that are athletes, it's important for them to be able to maintain their athletic prowess. So in every area, every age, every stage, that muscle mass and like actually building a little bit, even if it's on a small scale and working with weights, makes a big difference. And then I think the focus on whole foods. I think that with diet, people can vary quite a bit depending on their specific needs, how much activity they get, how much they burn calories throughout the day, if they're more sedentary or less sedentary. But overall, kind of trying to avoid a lot of these heavily processed foods that are out there can make a big difference regardless of the more specific things on what you eat.
Right.
And, if you're looking at a box and you're looking at the ingredients, you can't pronounce half of them. And then there's a list of 20 ingredients. That's probably a sign that it's not particularly healthy when you're eating a bunch of chemicals. So maintaining more, whole foods, whether it be, meats and eggs or, things like plant-based proteins, your fruits, your veggies, your whole grains, all of these things can help contribute to having a better overall, health picture and maintaining that health and wellness and longevity.
Right. I always look at it as like a car. So what kind of fuel are you going to put in your car? Are you going to put high test, or are you going to put in the regular with all the chemicals that are in there, right? Because that's going to ruin your engine, right? So,
that's a fun analogy.
Do you want to be a Ferrari or do you well, I won't mention the other cars because I've driven many. So, you do what you have to do, right? So, anything else that you wanted to add about so how do you see the future of, Ascend?
Well, I would love to expand upon, our group here and, add in over time additional physicians, but maintaining where every patient has their assigned physician, their relationship that they develop with that one person. That way it's still maintaining the one-on-one connections. And ultimately my hope in the long run is to create a wellness space where my patients have access to a variety of other health and wellness related things, in terms of the dietitian side, the massage therapy, having a psychologist that's readily accessible, because I think that having accessibility to these things is probably one of the things that deters so many patients from bothering getting a lot of the things that could improve their health and wellness every day. And the more easily accessible we can set it up and create that safe space where patients feel like, oh, okay, I can get everything that I need all under one roof. And these people really have my back and they really care about how I am right now, but also how I am 20 years from now. And, building upon this I think that's what matters. And creating that safe space that patients can really thrive and really feel like medicine is the way it's meant to be practiced, that they really keep that connection and that personalized approach. I think that's the name of the game. I think that's where we're headed.
Yeah, that sounds great. I love it. So you mentioned a psychologist, and so how I've noticed just in my practice that mental health is extremely important in the way people heal, the way they approach life, how pain affects them. So how do you see that in your practice as far as, how does mental health fit into the overall person's well-being?
Oh, it's absolutely huge. So being in primary care, I deal with a decent amount of kind of the general psychiatry and manage, stress, anxiety, depression, some post-traumatic things, insomnia. And these are bread and butter primary care things. But sometimes patients have a lot harder time with just doing the basics and, stress management techniques and things like that. And integrating with a proper psychiatrist that maybe can help diagnose some underlying problems, or a psychologist that can help do some of these specific guided therapies, whether it be, cognitive behavioral, or some of the techniques that directly introduce them to things that maybe they're trying to avoid or deem traumatic. And it can make a huge difference in how they function in their day-to-day life. Obviously, every patient's different. Every patient responds differently to different types of techniques and different people. And maintaining connections with people that you're comfortable with makes a really big difference, because especially in the psychiatry, psychology space, just like primary care, there's not going to be one person that works for everybody. It depends on their personality and their needs. And, some people are more comfortable with a male versus a female, or vice versa. So all that stuff will come into play. But I will say that in terms of just really the mental health, in terms of processing general like chronic pain type issues, in terms of, I think generally even just optimizing how you feel as a person and, how you view yourself and your value, how you manage stress with the job. Some of my people are very, high performers. When we're talking with people that are running companies, it can be very stressful, and being able to process these things on a daily basis and unload and not overburden yourself makes a huge difference. And your body will show you. I mean, from dealing with your sleep cycles to dealing with, your GI tract and all that kind of stuff. There are so many areas where your mental health is going to manifest in your physical well-being as well. They're very deeply connected.
Yes. So that's great that they can come to you and you can help identify some of those things, and just work with the overall team, that health team, on that, to try to make people as good as they can, at their best.
That's the goal.
Yeah.
All right. Yeah. Well, any other final questions for me?
I don't think so. I just really appreciate you being here. I appreciate what you do for your patients.
Likewise.
And I mean, I look forward to working with you in the future. So this is great. Yeah.
Thank you so much for having me. And
absolutely,
I feel the exact same way. It's comforting to know that if my patients need physical therapy, that I have somebody that not only has expertise, but I know truly cares about the patient's wellness and their full picture, and not just fixing an injury, but optimizing their health and how they feel and how they function on a day-to-day basis. And it's nice to have somebody that I can trust for that.
Yeah.
So thank you.
Thank you so much. All right. Okay, everybody. We'll see you soon.